Question 1. In light of recent developments, Mr. Williams, a nuclear radiologist, is preparing for a PET scan to assess a patient with suspected lymphoma. After reviewing the patient's history, he needs to select the appropriate radiopharmaceutical for the imaging study. Which of the following should Mr. Williams choose? A. F18 sodium fluoride. B. F18 fluorodeoxyglucose FDG. C. EC99 meters MDP. D. I131 sodium iodide. Answer. Correct answer. B. F18 fluorodeoxyglucose FDG. Explanation. F18 FDG is the most commonly used radiopharmaceutical for detecting lymphoma, as it is a glucose analog that accumulates in areas of high metabolic activity, such as tumors. FDG PET scans are highly sensitive for detecting malignancies, including lymphoma, because the cancer cell's increased metabolism results in higher FDG uptake. A. F18 sodium fluoride is primarily used for bone imaging and is not ideal for lymphoma detection. CTC99 meters MDP is used for bone scans, not for soft tissue imaging like lymphoma. DI131 sodium iodide is used for thyroid imaging and therapy, not for lymphoma detection. The guidelines for FDG PET in oncology, including lymphoma, are supported by the American College of Radiology (ACA) and the National Comprehensive Cancer Network (ESIN). Question 2. Given the circumstances, Dr. Baker is performing a quality control check on a gamma camera. He notices that the uniformity of the image is not optimal. What steps should Dr. Baker take next? A. Check the power supply and make sure the voltage is consistent. B. Perform a flood field correction. C. Replace the detector crystal immediately. D. Increase the camera sensitivity settings. Answer. Correct answer. B. Perform a flood field correction. Explanation. A flood field correction, also known as uniformity correction, is the appropriate step when the image uniformity is compromised. This procedure ensures that the gamma camera's images are homogeneous by adjusting for variations in detector sensitivity. A. Checking the power supply is general maintenance step, but it is unlikely to directly resolve uniformity issues. C. Replacing the detector crystal is unnecessary for uniformity issue unless there's physical damage or degradation. D. Increasing sensitivity would not correct uniformity problems and may cause further artifacts. ACA guidelines emphasize the importance of regular uniformity checks and calibrations as part of quality assurance protocols. Question 3. The primary reason for using hybrid imaging systems such as PET is A. To improve patient throughput. B. To provide higher resolution images of tumors. C. To combine functional and anatomical information for more accurate diagnosis. D. To reduce radiation exposure for the patient. Answer. Correct answer. C. To combine functional and anatomical information for more accurate diagnosis. Explanation. Hybrid imaging systems like PET combine the strengths of both modalities. PET provides functional imaging detecting areas of metabolic activity, while CT offers detailed anatomical structures. By fusing both images, physicians can more accurately localize and characterize tumors or other abnormalities. A. Hybrid imaging improves diagnostic accuracy, not necessarily patient throughput. B. PET does improve the accuracy of tumor detection but does not directly affect the resolution. D. While hybrid imaging can help optimize the use of radiation, its primary goal is diagnostic accuracy, not reduction of exposure. Guidelines from the Society of Nuclear Medicine and Molecular Imaging (SMMI) support the clinical use of PET, comprehensive diagnostic assessment. Question 4. To what extent does the ALARA principle apply in radiation therapy and nuclear radiology? A. It applies only to therapeutic radiation treatments. B. It is not applicable during diagnostic imaging procedures. C. It applies to all situations where radiation is used, ensuring the dose is kept as low as reasonably achievable. D. It only applies to occupational radiation exposure. Answer. Correct answer. C. It applies to all situations where radiation is used, ensuring the dose is kept as low as reasonably achievable. Explanation. The ALARA, as low as reasonably achievable, principle is fundamental in both diagnostic and therapeutic nuclear radiology. It applies to all uses of radiation, aiming to minimize exposure while achieving the necessary clinical results. A. ALARA applies to both diagnostic and therapeutic radiation use, not just treatments. B. The ALARA principle is crucial in diagnostic imaging as well, especially in minimizing patient exposure during procedures like CT or PET. D. While ALARA does apply to occupational safety, its scope extends to patient and environmental exposure as well. The NRC and FDA provide regulations that enforce ALARA STAT for both patient and staff safety. Question 5. What would happen if the radiopharmaceutical dosage administered to a patient exceeds the recommended limits for a thyroid treatment using I-131? A. It would increase the therapeutic effect. B. It would have no impact on treatment outcomes. C. It could lead to serious adverse effects, including thyroid damage. D. It would result in the need for a follow-up diagnostic scan. Answer. Correct answer. C. It could lead to serious adverse effects, including thyroid damage. Explanation. Exceeding the recommended dose of I-131 can lead to toxicity, particularly thyroid damage or even radiation-induced hypothyroidism. I-131 is commonly used for treating thyroid cancer or hypothyroidism, but careful dosage is crucial to avoid excessive radiation exposure to surrounding tissues. Excessive dosage increases the risk of toxicity, not therapeutic efficacy. B. Exceeding the dosage does not result in a neutral effect. It increases the risk of complications. D. A follow-up scan might be required, but it won't resolve the adverse effects of overdosage. Regulations by the NRC and the FDA ensure that dosages are strictly controlled to avoid such outcomes. Question 6. Based on the information provided, Dr. Harris is preparing to use a gamma camera to perform a SPECT scan for a cardiac patient. Which of the following steps should he prioritize to ensure the optimal quality of the scan? A. Use a low-resolution setting to avoid radiation exposure. B. Perform a calibration of the gamma camera before each scan. C. Increase the radiopharmaceutical dose to ensure better visualization. D. Reduce the number of images captured to minimize scan time. Answer. Correct answer. B. Perform a calibration of the gamma camera before each scan. Explanation. Calibration is crucial to ensure that the gamma camera is operating optimally and delivering accurate results. A well-calibrated camera will ensure the precision of image acquisition during SPECT scans. A. Lowering the resolution could compromise the accuracy of the scan. C. Overdosing radiopharmaceuticals does not improve image quality and increases unnecessary radiation exposure. D. Reducing the number of images may sacrifice diagnostic accuracy. ACA guidelines emphasize the importance of pre-scan calibrations in nuclear medicine to ensure the highest quality results. Question 7. When analyzing the biodistribution of a radiopharmaceutical, which of the following factors is most critical to ensure accurate imaging in a neurological study? A. The radiopharmaceutical's ability to cross the blood-brain barrier. B. The radiopharmaceutical's radiation half-life. C. The rate of excretion via the kidneys. D. The physical size of the radiopharmaceutical molecules. Answer. Correct answer. A. The radiopharmaceutical's ability to cross the blood-brain barrier. Explanation. For neurological studies, particularly those involving brain imaging, it is crucial for the radiopharmaceutical to cross the blood-brain barrier to accurately target brain tissues. B. While the half-life is important for timing and safety, it is less critical than biodistribution in neurological studies. C. Kidney excretion is more relevant in organs that are excretory in nature. E. G. Renal imaging. D. The physical size of the molecules is less critical compared to their ability to cross the blood-brain barrier. This principle is backed by protocols in neuroimaging guidelines from the Society of Nuclear Medicine. Question 8. Under the assumption that a patient is undergoing a bone scan with TC 99 meters MDP, what key considerations should the technologist keep in mind to optimize image quality? A. The patient should be hydrated to aid in the clearance of the radiopharmaceutical. B. The patient should remain fasting to avoid interfering with bone metabolism. C. The scan should be performed immediately after injection to avoid delayed uptake. D. The patient should be instructed to avoid any physical activity before the scan. Answer. Correct answer. A. The patient should be hydrated to aid in the clearance of the radiopharmaceutical. Explanation. Hydration is essential to ensure the optimal distribution and clearance of Tc99 meters MDP from non-target tissues, particularly the kidneys. Adequate hydration improves the imaging quality by minimizing background noise. B. Fasting is not required for bone scans. The focus is on hydration. C. Delayed uptake imaging is common for bone scans as it allows for optimal radiopharmaceutical localization. D. While physical activity may alter uptake in some cases, hydration is the primary consideration. These practices align with the recommendations from the ACA for T99 meters MDP bone scanning. Question 9. The most significant aspect of regulatory compliance in nuclear radiology is A. Ensuring that imaging procedures are only performed on patients with clear diagnoses. B. Adhering to radiation safety protocols to minimize exposure to both patients and healthcare workers. C. Ensuring all radiopharmaceuticals are labeled with patient identifiers. D. Limiting the use of expensive imaging systems to only urgent cases. Answer. Correct answer. B. Adhering to radiation safety protocols to minimize exposure to both patients and healthcare workers. Explanation. The primary concern in nuclear radiology is the safety of both patients and healthcare professionals. Regulatory bodies like the NRC and FDA enforce strict guidelines for radiation exposure limits. A. While patient diagnosis is important, regulatory compliance focuses more on safety. C. Proper labeling of radiopharmaceuticals is necessary, but is secondary to safety compliance. D. The use of imaging systems is determined by clinical need, not just cost considerations. The principles of radiation protection, such as the ALARA concept, are outlined in federal regulations and guidelines. Question 10. In the modern context of nuclear radiology, which of the following imaging techniques is particularly beneficial in evaluating the metabolic activity of tumors? A. MRI. B. SPECT. C. PET. D. X-ray. Answer. Correct answer. C. PET. Explanation. Positron emission tomography. PET is crucial for evaluating metabolic activity in tumors because it detects areas of high glucose metabolism, a hallmark of cancer cells. This allows for early tumor detection, staging, and treatment monitoring. A. MRI is primarily used for soft tissue imaging and does not provide metabolic activity information. B. SPECT provides functional imaging but is less sensitive than PET for metabolic evaluation. D. X-rays are used for structural imaging but do not assess metabolic activity. PET scans for oncology are widely endorsed by clinical practice guidelines from institutions like the SE. Question 11. In a modern context of radiation safety protocols, Dr. Williamson is reviewing the ALARA as low as reasonably achievable principle in his nuclear radiology department. He notices that one of the imaging rooms has higher radiation exposure levels than recommended. The team suggests 4 possible interventions. Which of the following strategies is the most effective way to immediately reduce occupational exposure? A. Increasing the distance between the radiation source and staff members. B. Using the higher energy radiopharmaceutical with a shorter half-life. C. Enhancing image quality by increasing radiation dose to reduce scan time. D. Removing shielding barriers to allow for better heat dissipation in the room. Answer. Correct answer. A. Increasing the distance between the radiation source and staff members. Explanation. The ALARA principle emphasizes 3 primary radiation protection strategies: time, distance, and shielding. Increasing the distance from the radiation source follows the inverse square law, which states that radiation exposure decreases by the square of the distance from the source. This is the most immediate and effective way to reduce occupational exposure. Option B is incorrect because a higher energy radiopharmaceutical may increase exposure despite a shorter half-life. Option C is incorrect because increasing the radiation dose for image quality contradicts the ALARA principle. Option D is incorrect because removing shielding increases exposure rather than reducing it. Question 12. Throughout the course of PET imaging, Dr. Patel needs to select an appropriate radiopharmaceutical for staging lung cancer. The options include various tracers with different metabolic pathways. Which of the following radiopharmaceuticals is most commonly used for this purpose? A. Sodium iodide 131. B. Fluorine 18 fluorodeoxyglucose F18FDG. C. Technetium 99 meters CertMedbry. D. Gallium 68 dotatate. Answer. Correct answer B. Fluorine-18 fluorodeoxyglucose F18-FDG. Explanation: F18-FDG is the most commonly used radiopharmaceutical in PET imaging for cancer staging, including lung cancer. It is a glucose analog that accumulates in metabolically active cells such as malignant tumors. Option A is incorrect because iodine 131 is primarily used for thyroid imaging and therapy, not lung cancer. Option C is incorrect because Tc-99 meters CertMedbry is used for myocardial perfusion imaging. Option D is incorrect because Gu-68 dotatate is used for neuroendocrine tumors, not lung cancer. Question 13. By evaluating the effectiveness of radionuclide therapy, Dr. Gomez is treating a patient with differentiated thyroid cancer. Which of the following factors is most important in determining the effectiveness of I-131 therapy? A. The patient's dietary iodine intake. B. The anatomical location of the tumor. C. The number of prior chemotherapy cycles. D. The patient's age and gender. Answer. Correct answer A. The patient's dietary iodine intake. Explanation: Iodine 131 therapy relies on the thyroid's ability to uptake iodine for effective treatment. High dietary intake of stable iodine reduces I-131 uptake by the thyroid, decreasing treatment efficacy. Patients are typically placed on low iodine diet before therapy to maximize radioiodine uptake. Option B is incorrect because while tumor location affects surgical planning, it does not directly impact I-131 uptake. Option C is incorrect because prior chemotherapy does not influence iodine uptake in thyroid tissue. Option D is incorrect because age and gender do not significantly alter I-131 uptake. Question 14. When considering the biodistribution of radiopharmaceuticals, which organ system is most commonly affected by radiolabeled monoclonal antibody therapies such as Y90 ibrituximab? A. The gastrointestinal tract. B. The cardiovascular system. C. The hematopoietic, bone marrow system. D. The endocrine system. Answer. Correct answer C. The hematopoietic, bone marrow system. Explanation: radiolabeled monoclonal antibodies like Y90 ibrituximab target B-cell lymphomas but also impact bone marrow, leading to potential hematologic toxicities such as thrombocytopenia and neutropenia. Option A is incorrect because the gastrointestinal tract is not a primary site of toxicity. Option B is incorrect because cardiovascular effects are minimal. Option D is incorrect because endocrine organs are not significantly affected. Question 15. Given the circumstances in nuclear medicine imaging, which of the following is a key advantage of PET-RI over PET? A. PET-RI has low cost and greater accessibility than PET. B. PET-RI provides superior soft tissue contrast with reduced radiation dose. C. PET-RI offers faster scan acquisition times than PET. D. PET-RI does not require any radiopharmaceutical administration. Answer. Correct answer B. PET-RI provides superior soft tissue contrast with reduced radiation dose. Explanation: PET-RI provides better soft tissue resolution than PET, making it useful for neurological and oncologic imaging. MRI uses non-ionizing radiation, reducing overall patient radiation exposure. Option A is incorrect because PET-RI is more expensive and less widely available. Option C is incorrect because PET-RI generally has longer scan times compared to PET. Option D is incorrect because PET-RI still requires radiopharmaceuticals like F18-FDG. Question 16. During a nuclear cardiology examination, Dr. Smith is performing a myocardial perfusion scan using Tc-99 meters CertMedbry. The patient has a history of chronic kidney disease. Which of the following factors is most critical in interpreting the scan results? A. The patient's hydration status. B. The patient's heart rate during stress imaging. C. The patient's glomerular filtration rate, GFR. D. The patient's body mass index, BMR. Answer. Correct answer C. The patient's glomerular filtration rate, GFR. Explanation: Tc-99 meters CertMedbry is cleared primarily by the hepatobiliary system, but renal impairment could affect its biodistribution and clearance. In patients with chronic kidney disease, altered pharmacokinetics may lead to increased background activity and reduced washout, which could affect scan interpretation. Option A is incorrect because hydration status primarily affects renal function but has minimal impact on CertMedbry distribution. Option B is incorrect because heart rate affects stress test performance but not CertMedbry clearance. Option D is incorrect because BMI affects attenuation artifacts but not biodistribution. Question 17. A 45-year-old female patient with a history of neuroendocrine tumors is scheduled for a gallium-68 dotatate PET scan. Which of the following best explains the mechanism of action of Go68 dotatate? A. It binds to glucose transporters in highly metabolic tumor cells. B. It selectively targets the somatostatin receptors expressed on neuroendocrine tumors. C. It accumulates in areas of high osteoblastic activity. D. It functions by directly labeling DNA in rapidly dividing tumor cells. Answer. Correct answer B. It selectively targets the somatostatin receptors expressed on neuroendocrine tumors. Explanation. Go68 dotatate is a somatostatin analog that binds specifically to somatostatin receptors, SER, overexpressed on neuroendocrine tumors, allowing for precise tumor localization. Option A is incorrect because glucose transporters are targeted by F18-FDG or Go68 dotatate. Option C is incorrect because osteoblastic activity is associated with bone scans using TC99 meters NDP. Option D is incorrect because direct DNA labeling is not the mechanism of Go68 dotatate. Question 18. A patient undergoing iodine-131 therapy for thyroid cancer is instructed on radiation safety precautions. Which of the following recommendations is most appropriate to minimize radiation exposure to family members? A. The patient should avoid close contact with others for at least 48-72 hours. B. The patient should wear lead apron when interacting with family members. C. The patient should take potassium iodide tablets to reduce radiation exposure. D. The patient should undergo whole-body scanning immediately after therapy. Answer. Correct answer A. The patient should avoid close contact with others for at least 48-72 hours. Explanation. Patients receiving I-131 therapy emit gamma radiation and can expose others to radiation through proximity and bodily fluids. The Nuclear Regulatory Commission (NRC) recommends that patients maintain safe distance from others, particularly children and pregnant women, for at least 48-72 hours. Option B is incorrect because lead aprons do not shield gamma radiation effectively. Option C is incorrect because potassium iodide is used for thyroid blockade, not for post-therapy radiation protection. Option D is incorrect because whole-body scanning does not minimize exposure to others. Question 19. Which of the following imaging modalities is best suited for assessing suspected pulmonary embolism in a patient with renal failure? A. ET pulmonary angiography ETPA. B. Ventilation perfusion VQ scan. C. PET with F18-FDG. D. MRI pulmonary angiography. Answer. Correct answer B. Ventilation perfusion VQ scan. Explanation. In patients with renal failure, CT pulmonary angiography (ETPA) is often avoided due to the risk of contrast-induced nephropathy from iodinated contrast agents. EK is preferred because it does not require nephrotoxic contrast. Option A is incorrect because ETPA requires Romaney contrast, which can worsen renal function. Option C is incorrect because PET is not routinely used for pulmonary embolism. Option D is incorrect because MRI has limited sensitivity for pulmonary embolism. Question 20. In a pediatric patient undergoing an FA/NEDG PET scan, which of the following is the most effective method to minimize radiation exposure? A. Using a higher dose of FA/FDG to shorten scan time. B. Increasing CT tube voltage to improve image quality. C. Applying weight-based dosing of F18-FDG and lowering CT parameters. D. Performing a delayed scan to improve radiotracer uptake. Answer. Correct answer C. Applying weight-based dosing of F18-FDG and lowering ET parameters. Explanation. Pediatric patients are more sensitive to radiation, so the best approach is to adjust F18-FDG dose based on weight and use low-dose CT protocols for attenuation correction, minimizing unnecessary radiation exposure. Option A is incorrect because higher doses increase radiation burden. Option B is incorrect because increasing CT voltage increases radiation exposure. Option D is incorrect because delayed scans result in high cumulative radiation dose. Question 21. A 65-year-old patient with a history of prostate cancer is referred for a PET scan using F18-fluciclovine. What is the primary advantage of F18-fluciclovine over F18-FDG in evaluating prostate cancer recurrence? A. Higher specificity for detecting bone metastasis. B. Less urinary excretion, improving pelvic imaging. C. Stronger uptake in normal prostate tissue. D. Faster clearance from blood, reducing background noise. Answer. Correct answer B. Less urinary excretion, improving pelvic imaging. Explanation. F18-fluciclovine exhibits low urinary excretion, making it particularly useful for detecting recurrent prostate cancer in the pelvis where urinary excretion of FDG can obscure lesions. Option A is incorrect because F18-fluciclovine is not superior to PSMA PET for bone metastasis. Option C is incorrect because normal prostate tissue uptake can sometimes be a limitation. Option D is incorrect because faster clearance does not improve specificity for recurrence. Question 22. A 40-year-old patient is undergoing a DAT scan to evaluate suspected Parkinson's disease. What is the primary radiotracer used in DAT scan imaging? A. I123I-fluoropane. B. F18-FDG. C. TC99 meters-Itchesh-Pau. D. Gus68 dotatate. Answer. Correct answer A. I123I-fluoropane. Explanation. DAT scan uses I123I-fluoropane, which binds to dopamine transporters DAT in the striatum. It helps differentiate Parkinsonian syndromes from essential tremor. Option B is incorrect because F18-FDG is used for metabolic imaging. Option C is incorrect because TC99 meters-Itchesh-Pau is used for cerebral blood flow imaging. Option D is incorrect because Gus68 dotatate is used in neuroendocrine tumors. Question 23. Which of the following nuclear medicine studies is most appropriate for evaluating cardiac sarcoidosis? A. TC99 meters MIBI myocardial perfusion scan. B. F18-FDG PET. C. Gus67 scintigraphy. D. TC99 meters pyrophosphate scan. Answer. Correct answer B. F18-FDG PET. Explanation. F18-FDG PET is the gold standard for detecting active inflammatory sarcoidosis in the myocardium, as granulomatous inflammation leads to increased glucose uptake. Option A is incorrect because TC99 meters MIBI assesses perfusion, not inflammation. Option C is incorrect because Gus67 is less sensitive than FDG PET. Option D is incorrect because TC99 meters pyrophosphate is used for cardiac amyloidosis, not sarcoidosis. Question 24. Which of the following factors most affects the spatial resolution of a gamma camera? A. Collimator design. B. Patient hydration status. C. Radiotracer half-life. D. Crystal thickness of the detector. Answer. Correct answer A. Collimator design. Explanation. The collimator determines how photons reach the detector, directly influencing spatial resolution. Option B is incorrect because hydration affects biodistribution, not resolution. Option C is incorrect because half-life affects signal intensity, not resolution. Option D is incorrect because thicker crystals increase sensitivity but lower resolution. Question 25. A patient undergoing I-131 therapy for hypothyroidism should be instructed to avoid which of the following before treatment? A. Seafood and iodine-containing supplements. B. High-protein diets. C. Beta blockers. D. Drinking excessive water. Answer. Correct answer A. Seafood and iodine-containing supplements. Explanation. Excess dietary iodine competes with radioactive iodine uptake in the thyroid, reducing I-131 therapy effectiveness. Option B is incorrect because diet does not directly affect I-131 uptake. Option C is incorrect because beta blockers are commonly prescribed for hypothyroid symptom control. Option D is incorrect because hydration does not interfere with thyroid iodine uptake. Question 26. Which PET radio tracer is most useful for imaging neuroinflammation? A. F18-FDG, B. F18-flutamide-amol, C. C11PK, D. I123-MIB. Answer. Correct answer C. C11PK. Explanation. C11PK binds to translocator protein T-spur in activated microglia which are involved in neuroinflammation. Option A is incorrect because F18-FDG reflects metabolic activity, not specific inflammation. Option B is incorrect because F18-flutamide-amol is used for amyloid imaging. Option D is incorrect because I123-MIG is used for cardiac sympathetic innervation imaging. Question 27. Which of the following conditions is best evaluated with Tc99 meters sulfur colloid imaging? A. Liver hemangioma, B. Splenic sequestration, C. Bone metastasis, D. Parathyroid adenoma. Answer. Correct answer B. Splenic sequestration. Explanation. Tc99 meters sulfur colloid is taken up by Kupffer cells in the liver and spleen, making it useful for detecting splenic sequestration. G. In sickle cell disease, option A is incorrect because liver hemangiomas are best evaluated with Tc99 meter RBC scans. Option C is incorrect because bone metastases are evaluated with Tc99 meters MDP scans. Option D is incorrect because parathyroid adenomas use Tc99 meters CertMedbry. Question 20. Which nuclear imaging study is most useful in diagnosing pulmonary hypertension? A. VU-CAN, B. F18-FDG PET, C. Tc99 meters MAR perfusion scan, D. I123 iobenguane scintigraphy. Answer. Correct answer C. Tc99 meters MAR perfusion scan. Explanation. Tc99 meters MAR perfusion scans can assess pulmonary vascular obstruction, a key feature of chronic thromboembolic pulmonary hypertension (CTEPH). Option A is incorrect because VU-CAN is used for acute P diagnosis. Option B is incorrect because FDG PET is not standard for pulmonary hypertension. Option D is incorrect because I123 iobenguane is used for sympathetic nervous system imaging. Question 29. 50-year-old female with a suspected parathyroid adenoma is scheduled for a parathyroid scintigraphy using Tc99 meters CertMedbry. What is the expected finding if the parathyroid adenoma is present? A. Increased uptake in the thyroid and reduced uptake in the adjacent parathyroid gland. B. Increased uptake in the thyroid and increased uptake in the abnormal parathyroid gland. C. Decreased uptake in the thyroid and increased uptake in the parathyroid adenoma. D. Increased uptake in the thyroid and homogeneous uptake in the surrounding tissue. Answer. Correct answer C. Decreased uptake in the thyroid and increased uptake in the parathyroid adenoma. Explanation. Tc99 meters CertMedbry is used for parathyroid scintigraphy because it accumulates in parathyroid adenomas due to their increased metabolic activity. The thyroid will show reduced uptake compared to the parathyroid adenoma, which will have increased uptake. Option A is incorrect because the parathyroid gland should not have reduced uptake relative to the adenoma. Option B is incorrect because the thyroid typically shows lower uptake than the parathyroid adenoma. Option D is incorrect because the uptake is not homogeneous in cases of parathyroid adenomas. Question 30. A patient undergoing treatment for bone metastasis from prostate cancer is receiving radium-223 therapy. What is the primary mechanism of action of radium-223 in treating bone metastasis? A. It emits beta radiation to directly damage tumor cells in the bone. B. It inhibits osteoclast activity to prevent bone resorption. C. It stimulates the immune system to target bone tumors. D. It acts as a radioprotective agent to shield surrounding tissues. Answer. Correct answer A. It emits beta radiation to directly damage tumor cells in the bone. Explanation. Radium-223 is the alpha particle-emitting radiopharmaceutical that targets bone metastasis, particularly in prostate cancer, by emitting beta radiation that directly damages tumor cells in the bone. It mimics calcium accumulating in areas of bone metastases. Option B is incorrect because radium-223 does not inhibit osteoclasts. It targets bone metastasis. Option C is incorrect because radium-223 does not stimulate the immune system directly. It is a radiotherapy agent. Option D is incorrect because radium-223 does not have radioprotective properties.